This is the front view here. And you can see the bone bruising here laterally. And then they do not see that there's a tear of the meniscus, this lateral meniscus, but this lateral meniscus is sort of extruded up into the gutter. You see that? Where it should be underneath you here, which sometimes that means that is torn back toward the root here, but we don't see a tear there. But if you end up doing surgery on this, we'd be careful to look back here to see if that's torn. Sometimes we put stitches to try and drag that back down in again.
Okay.
But they don't view it as
Hello everyone. Hi, so I just finished most of my recovery for my knee, for my ACL injury on my left knee. So as it turns out, it's been 30 days. The first 4 days were really being very careful, sitting down most of the time, you know, doing some flexing. See, the thing is, like, you want to make sure that you extend and practice extending your knee. By that I mean, you know, you're straightening it out. Because what happens is there's a risk that you can lose some of the full extension. Like your knee may never fully go all the way again. So you want to make sure that you are practicing extending your leg. Also, like, you know, this is what the doctors and physical therapists told me. Also, you really don't have much of a risk, they told me, of hyperextending or overextending your knee because it just can't get there. So that's one thing to do. The other thing you want to do is like pulling it down and trying to get, you know, not too far, but to the point where they tell you that you can bend it. That's also important because I was told that that helps move the inflammation out of your leg. The other thing is, for the first couple of days, I did actually fall, and that was because there was a book underneath my crutch. And that book slipped and I fell down, but I fell down sideways, so I didn't get hurt. And I thought I got hurt. I rushed to the doctor because you really don't want to, you know, rip the ACL again, especially after you just had it fixed. So you want to make sure that you're very careful in those first few days. There was some pain. There were two different types of pain that I had. The first type of pain was like, it kind of felt like a bee sting. That was basically the nerves recovering and also having like way too much swelling. It caused, in my shins mostly, like a bee sting type feeling. So when I fell down sideways, it gave me that feeling, like this bee sting feeling, and I got super scared. I was perfectly fine though. The other type of pain was like this angry throbbing feeling. It wasn't really too bad. I mean, I just would take Tylenol and I would be okay. I did pretty well with pain. I was given some, you know, powerful pain medicine, but I didn't really use it much because the pain was pretty manageable for me. And part of the reason is because I am young enough and I'm fit enough, you know, from doing martial arts, as you saw in the video, and also in preparation for this. I know you think I'm crazy, but I rode a scooter from my car to my office. And part of the reason I did it every day was because it helped my knee get ready for the surgery. And I know people looked at me, but I felt like, you know, so what? I really have to get ready for the surgery. Doctor was really impressed with that. He thought that riding a scooter, you know, every day, and I would switch both legs, not only helped build up the quadricep muscles, the front of your leg, but also the my sense of balance, which is important too. So the recovery's been pretty good. Doctors were impressed, and I keep moving right along. So that being said, thank you very much. Please make sure you subscribe to my channel. And, you know, that's why I haven't been doing much else, because I've really just been busy with this. Besides tons of other things. You know, John Lennon once said, life is what happens to you while you're busy making other plans. So that's how it is. Anyway, thank you very much.